Hi everybody. All right, so this is our live Q&A about Invisalign. So hope you all are having a wonderful lunch on this super snowy day. I just want to take a minute to give a shout out to my lovely team who I couldn't do this without, who are, every month we take our lunch hour, and we actually take an hour, and we do what we call random acts of kindness. So today they are out as we speak shoveling driveways. So if you see them, give them a honk. Just trying to do something good and get some positivity out there. We have fun doing it, so I want to give a shout out to them. So I have two people following. I can't see on my phone though who's watching, but thanks for tuning in to the live Q&A. If you have a question, I think just pop it in the comments box, and I will for sure answer any questions that you might have about Invisalign. So part of the reason why we're doing this Q&A is because I answer almost the same questions every single day about Invisalign. So the first thing we're gonna talk about is what exactly is Invisalign. So Invisalign is just another tool to straighten teeth and correct bites. So there's two reasons why we would recommend orthodontic treatment that in general most patients would consider as braces, but Invisalign is another tool in our toolkit to straighten and align teeth. So I just want to make sure everyone understands I am a general dentist who does provide orthodontic treatment in my office. I've been doing Invisalign since probably 2005, and I've been treating patients with braces since about 2003, somewhere in there. So we've been treating patients for all sorts of orthodontic problems for a really long time. But let's get to what is exactly Invisalign. So I'm going to show you an Invisalign aligner. So this is what an Invisalign aligner looks like. Now, in the course of Invisalign treatment, you are going to have a series of these aligners. The way that the treatment works is built into each aligner is a small movement. So as you wear each aligner, which you're going to wear for 2 weeks, your teeth will move into the position built into that aligner. Then what you do is at home, you are going to switch to the next aligner. You wear that one for 2 weeks. Generally, I'm going to give you 3 sets of aligners, which means I see you in the office about every 6 weeks where we're going to check your progress. So let me show you how these fit. So this is the aligner. This is the tooth model. Okay, so this is how the aligners go on, and generally this is how they will go onto your teeth. Make sure, hi all the followers, if you have a question, make sure you please post it. So this is how they basically snap in. So you can see, if I turn this the right way, you can see I generally will tell patients at a conversational distance, people will not see that you have anything on your teeth. If they look really up close, but most people actually tell people they're doing Invisalign because they're so excited about it. But if you look up close, you'll be able to see the shininess of the aligner. But basically, from a conversational distance, it's going to be invisible. Hence the name Invisalign. Okay? So again, this is the aligner. That's the tooth. That's how it looks on the tooth. And that's how easy it is to take on and off, okay? You wear these aligners while you're in treatment. You're gonna wear the aligners 22 hours a day. So I tell my patients who are in Invisalign treatment, the more you wear them, the better it's gonna work, but also that you are only taking your aligners out to clean them and brush your teeth. to eat your main meals, and that's generally about it. I tell my patients to drink with them in. I tell my patients to snack with them in. That way it's the easiest way to get your 22 hours of wear time in, and you're changing them every 2 weeks anyway. So every 2 weeks, you're gonna get a bright, fresh, new aligner. And in fact, when my patients come in and their aligners look too clean, I get nervous that they haven't been wearing them. So 22 hours a day is when you're going to wear your aligners. So again, the aligners, in each aligner is built into a small movement. So you're going to get, this is a sample of how the aligners come. You can see this particular case has 20 aligners. This is number 8 of 20. So you start by wearing number 1. There's a small movement built into aligner number 1. You wear it for 2 weeks. You switch to aligner number 2. Aligner number 2 again has another small movement built in. After 2 weeks, you switch to aligner number 3. How and what are the aligners made of? So what we do to actually start Invisalign treatment is quite easy. It really only takes probably 20 or 25 minutes in our office. We have to get what's called an initial set of records, which is where this thing behind my shoulder comes in, which is our really cool scanner called an iTero. So I'll just sort of switch this over so that we can actually look at what happens. So instead of doing old style impressions and putting that gooey material in, what we're gonna do instead is take a scan of your teeth. So the scan, I'm just gonna show you a scan that we've done. The scan takes us, literally my assistants are really good at it. I don't generally do it, but it takes us probably, I would say on average, maybe 4 to 7 minutes to complete a scan. So then what happens is we get to look at your teeth on the screen. But the most cool thing, and then this gets actually sent to Invisalign in Costa Rica, which is where they actually do all of the clin checks, and then they have a manufacturing facility for the aligners in, oh gosh, I think it's somewhere in Mexico. It's really, truly an unbelievably technologically advanced company who has put so much time and effort and research and development, more than any other orthodontic company, I would say, out there. So this is what your teeth look like after we do the scan. Now, the really cool thing that I love so much about Invisalign is you get to see the results, the typical expected results, before you even start treatment. So what we can do is we can do a quick scan, takes us 4 to 7 minutes, and then what we're gonna do is we're gonna run this thing called an outcome simulator. So it's gonna run behind me just as I chat about it, but basically after the scan is done, Invisalign, using the iTero, is going to run it through its sort of proprietary software of how they move teeth. And it comes up with a simulation of how your teeth can look at the end of treatment. So we're gonna look at this particular simulation, which I think actually turned out very well. Obviously, I'm gonna go in, hey, thanks for the likes, thanks for the follows. I'm gonna go in afterwards and I'm going to tweak it to make sure that I like how the teeth fit, I like how they look, and they're arranged in the way that they should be arranged. So iTero's just running through the software where we'll get a chance to have a peek at the expected outcome. Okay, so while that's running, I'll go through a couple other questions that kind of got pre-submitted. So what can Invisalign work on? Like, how can it work? Is it just, oh, let's have a quick peek. Okay, so this is, I see I have a glare. There we go. There we go. Okay, so this is basically start, and that's kind of where you can expect to go typically with Invisalign. So if we just do this, and that took what, maybe, oh, I don't know, a minute, less than a minute, to show you a typical kind of outcome of what we can expect. So if we switch this to just look at the upper arch, I can flip this around for you, and you can kind of get maybe, and I'm gonna open it a little bit if I can. There we go. So you can kind of get a sense for how Invisalign is going to move the teeth and how we're able to fit this tooth into position. The arch form should look like a nice rainbow. You see this look like a rainbow on that one. So sometimes going front on, the view front on can look dramatic, but more so when we look at arch forms, we can really get a sense for how the teeth have moved. So this is this particular patient's upper arch. I'll just look at the lower. And that is this particular patient's lower arch. In my hands, I've done probably close to 300 Invisalign cases at this point. In my hands, with the techniques that I use and the sort of training that I've been given, I think this is a very typical and achievable result with Invisalign, which leads to the question that I was about to answer is, what can Invisalign do? What can we work on? So generally, in my practice, and like I said, I've been treating orthodontic patients as a general dentist since 2003, and I've been doing Invisalign since 2005. Generally, I would say prior to about 3 years ago, my practice was more geared towards doing traditional braces. Since that time, I've just taken more training. I think the Invisalign training, platform, material, treatment has progressed to the point where I feel fairly comfortable taking on most cases with Invisalign. So there are some cases that cannot be treated with Invisalign, but you would have to come in. We offer complimentary consultations for any patient interested in Invisalign. And in fact, we would do a scan on any patient who wanted to see sort of their before and after to see what it could possibly be a result for them. And we do that complimentary as well. So I'm happy to chat with anybody, but I would say probably of everybody who comes to see me for orthodontic consultations, I would say 80 to 90% we are definitely can recommend and achieve great results with Invisalign. Okay? What are the huge benefits of Invisalign compared to braces? I say a big one, and we're doing more and more, we're getting into treating teens with Invisalign. One of the huge advantages of treating with Invisalign is the fact that you get to take those aligners out and clean your teeth the way you normally would. So you take the aligners out, you brush the way you normally would, you floss the way you normally would, and you put the aligners back in. Teenagers, so the biggest downside to Invisalign with anybody, not just with teenagers, is you have to wear it. So you have to wear it 22 hours a day in order to get the proposed results or the proposed changes in your mouth. Rather than with braces, we sort of put them on and you don't have a choice but to wear them. They're working whether you want them to or not, but they're difficult to clean around. So that's one huge benefit that we talk about with Invisalign is the cleanliness and being able to clean like normal. I honestly, of all the teenagers I've treated, they generally have been very good. Parents are always concerned, are they going to lose the aligners? Is he going to wear them? Is she going to have them? Most teenagers who I have coming in are very motivated to do treatment. They want their teeth straightened. They want their teeth fixed. So they wear the aligners. I generally don't have an issue with them wearing aligners. Okay? Most patients want to know, how long do things take and how much does it cost? So I would say a typical Invisalign case is going to be anywhere from 12 to 18 months. And I would say that's very typical and very reasonable to expect a good result after that amount of time for most situations. Obviously, there's some that are going to be longer and some that are going to be shorter. Costs, there's a range of costs in my office. We charge the same for Invisalign and braces. I do that specifically so that patients and parents can choose the best option that they feel fits with them. We don't have to make any decisions based on price. So somebody doesn't have to pick braces because they might be cheaper, or pick Invisalign because it might be cheaper. So we're costing things the same, and that's in my particular office. And I would say fees range generally anywhere from, on the low end, I would say orthodontic treatment could be as low as $4,000, and in my office probably go up to anywhere around $7,500 to $7,900. And really it depends on the severity of the case as to how we are feeing and billing those cases. Am I too old to have Invisalign is a question that we get a lot. Or patients who could benefit from Invisalign that we chat with say things like, well, I'm too old for that. So let me tell you, you are never too old to A, get a smile that you've always wanted, but B, orthodontic treatment and Invisalign or braces, a lot of times is not, the sole purpose of it is not simply just about the cosmetics of your teeth. That's a big reason why we do orthodontic treatment, because people want pretty nice straight smiles. But the other huge reason we do Invisalign or orthodontic treatment is to straighten teeth, to give people better bites, which are healthier in the long term, but also to improve patients' cleansability. So if you look at this particular case, I think it's not super sort of hard to understand that in this case here with his patients before, these areas are really hard to clean. They're hard to get floss in, they're hard to get your toothbrush in, and they're just generally going to be areas where either decay will start or gum disease will start because they're hard to clean. This is way more cleansable. It's way more easy to clean and keep clean, straight teeth. So going back to the age question, it is never too late. You are never too old. So I have actually a really great story. I treated a lady who was 79 with Invisalign. She came to see me because she thought she wanted dentures on her bottom teeth. And what it really came down to is that she wanted her bottom teeth to be straight and be white. And she thought her only way she could get that was with dentures. Now, we chatted and I said, no, that's not the only way you could get this. So we did Invisalign for her and we did some whitening. And she was thrilled with how everything turned out and that she got to keep her own teeth. So there's just kind of a cool story about how you're never too old to achieve the smile that you've always wanted. So how often would I have to visit the office once we get started? So generally in a typical case, I'm seeing you every 6 weeks to check your progress. Now, we do have lots of patients who come from out of town, so we can make some arrangements the odd time to push it out a little bit, but generally every 6 to 8 weeks, depending on your schedule and depending on my schedule, is when I'm gonna see you. That's how often you need to come in. So you're gonna wear the active aligners for 12 to 18 months is a typical case. After you're done, you will have retainers. So retainers look exactly like this, except they're made of a different type of plastic because they're meant to be worn a little bit longer. We're not actually moving the teeth at that point, we're just retaining the teeth. So retainers go on at the end. You're gonna wear retainers full time for a short while, and then we're gonna get you down to nighttime only wear. Now, my patients will commonly ask, well, how long do I have to wear my retainer at nighttime? And my sort of politically correct answer is that I want you to wear your retainer so long as you don't want your teeth to move. So that's kind of my standard answer. If you don't want your teeth to move, please wear your retainer, okay? Is there any foods you have to avoid, like when in braces? Absolutely not, because when you take your aligners out to eat, so you can eat anything you want with Invisalign. Unlike braces, where you do have to be a little bit careful with things that you're eating so that you don't sort of break brackets or break wires and things. How to start Invisalign. So, like I said, it starts with this scan, which takes us generally 4 to 7 minutes. We are also going to take a series of photographs of you and your teeth and a series of x-rays of you and your teeth. And that's so we can properly plan the case, and we have what we call an initial set of records. That entire appointment in my office generally will take, I would say, 20 to 30 minutes. Then what happens is we send this scan, the photos and the x-rays off to Invisalign. They plan the case, and I go back and forth with the planning department to make sure that I like exactly where they've said that they're going to move all of the teeth. And then we hit accept, and then we're going to get all of the aligners all in one shot. So this case has 20 aligners. So this case would come to us in a box, and I would have all 20 aligners in the office. And again, I give you out 3 aligners at a time, okay? So that's basically how you get started. We're always happy to do complimentary consultations to chat with you about what you're looking for, what your goals are for your teeth, and if we can help you achieve that with Invisalign or something different. We do have 2 doctors in our office who are certified to do Invisalign. So there is myself and Dr. Stone. I know lots of you know Dr. Stone and have seen Dr. Stone for many years. She's been in our office for, I think, 11 years now. So both of us are certified to do Invisalign. We work very closely day in and day out. We are constantly looking at cases together, problem solving together, and it just is a great collaboration between the 2 of us. And I think our patients are lucky to have that in 2 doctors who can chat back and forth. So either of us are happy to take a look at your case. A super common question that we do get is it covered by my insurance? So I think that we at Slave Lake Dental are amazing at working with our patients and helping them to understand their insurance. So we're happy to call your insurance benefits for you to find out. Generally, the way orthodontic insurance works is you either have the benefit or you don't. If you have the benefit, this is not considered cosmetic treatment. This is considered orthodontic treatment. So generally, if you have the orthodontic benefit, they will pay towards Invisalign. Most plans we're seeing now have anywhere between $1,500 to a really great plan might even have $5,000 of coverage going towards orthodontic treatment. So we definitely will take assignment, which means we will have the insurance company send us their portion, and you only have to pay your portion, which is what we do with our regular general dentistry all the time anyway, just to make it easy for you. And then we do offer payment plans that we would bill monthly in order to take up the remaining balance. So lots of times people assume that Invisalign is not going to be covered by insurance because it's maybe cosmetic, but if you have orthodontic benefits on your plan, it definitely will help you pay and cover a portion of your Invisalign. So yeah, that's super positive, and lots of our patients are thrilled to find out that they actually have that benefit. So if you want us to find out for you, please give our office a call at 780-849-2233. We would be definitely happy to do a complimentary benefits check for you. And if you want to schedule an appointment for an Invisalign consultation, we would be happy to do that at the same time. Like I said, we can run a scan, show you your very own before and after on Invisalign. Our office loves Invisalign. I have 3, maybe even 4. I think maybe even 4 of our team members right now, oh gosh, no, maybe even 5 of my team members right now are currently in Invisalign treatment. So they're such a great resource to chat with. They have lots of tips and tricks, and they are speaking from firsthand experience to let you know and understand how Invisalign works and what you can expect from it. So I think that kind of answers or goes through most of the questions. I'm just looking down at my little cheat sheet here. Yeah, so like I said, most people generally want to know, how long is it going to take? How much is it going to cost? Will it work for me? And does my insurance help me pay for it? So call us, 780-849-2233. We're happy to see you on your schedule to figure out if you're a candidate and answer all of those questions specifically for you. So I think, Oh, okay, and that consultation is complimentary. Yes, okay. Chantel just came in to make sure I said that and remind me. So, yeah, so give our office a call. Ask to speak with Michelle or Sarah. They can definitely get you into our schedule. We always have spots set aside to see patients for Invisalign consultations. So, yeah, I hope to hear from you soon. I hope this was helpful for all of you watching. I unfortunately don't know who you are because it doesn't pop up on my phone, but thanks so much for taking the time. Share this video and hope to see you in the office soon. Okay, thanks. Bye.